Social Care Student Visit to Great Ormond Street Hospital by Tanash Shambambiri. Tanash is BBS UK's second student to undertake a placement within our advice service as part of his university degree in social care. He is shadowing Rebecca and Shirin as they work, assisting with casework, learning all about BBS and the complexities of navigating local authorities and other support services, as well as visiting our clinics to see firsthand how vital the clinics are for our members. He describes his first clinic visit in the article below. In February, I had the pleasure of attending my first BBS clinic, which was the Children's Clinic at Great Ormond Street Hospital. Gosh! Shirin is one of the BBS UK social workers and patient liaison officers, and she was there to greet me at reception. I'm not someone who usually expresses many emotions, but even I felt a rush of emotions when I walked onto the clinic floor. It brought back memories of my early years when I had spent a lot of time in a similar setting with a loved one. I was introduced to the GOSH team of clinicians and was a little overwhelmed at first because I'd never been in a room with so many different health professionals before. But after the friendly introductions, I felt completely embraced by them. I met the nephrologist, clinical psychologist, geneticist, speech and language therapist, ophthalmologist, endocrinologist, and dietitian. I was given the chance to sit in with one family for several of their meetings with the clinicians. At GOSH, the family are allocated a room and each clinician in turn spends approximately 20 to 30 minutes with them. It was great to experience in person how each clinician treats the family in a similar, non-judgmental manner. I was able to pick up some important life lessons from each clinician, which was fantastic because it felt like a big, exciting day of learning. When the clinician left to take care of another family, I took the chance to establish a connection with the family by asking some questions, sharing my cultural background, which they could relate to, and generally getting to know each other. After having the opportunity to introduce myself to another family with my supervisor Shirin, I was comfortable enough to use our database to confirm the accuracy of that family's information. Since it was my first day, I appreciated the clinicians and families' patience with me as I grasped how to use the database. I took away several things from my visit at GOSH. The importance of good communication from the health clinicians to the families, the value in being non-judgmental as each family comes from different cultures which include different values and religions, as well as the power of building a rapport and relationship with families. I observed how families feel free to elaborate on their current issues or concerns for the children when a rapport is built, rather going straight into asking lots of questions without a warm greeting or asking how they are doing. Attending the clinic in person gave me a better understanding of some of the key features of BBS, such as visual impairment and decreased mobility, as well as how BBS impacts children. I was also able to observe how the different health professionals work together to give the family and child the best possible outcome. I look forward to my next clinic visit at Great Ormond Street Hospital.